let's say you have interns in your hospital and they're doing their first kind of like clinical interview. What kind of things or tips would you recommend for them?
I think obviously a lot of this just takes practice, right? And you're going to have to go through a couple that are awkward. I mean, even 10 years in, I was doing interviews that turned awkward, and it just takes practice, right? But Hilary and I were talking about the balance between getting all of your check boxes done on your assessment and really building rapport with a client that might be there that doesn't want to be there. They might be court ordered. They might be like at the psych hospital. In my case, they didn't want to talk to nobody. They just wanted to sleep. So you really have to balance that building rapport and having an authentic relationship, treatment relationship with them, while also getting your paperwork done. And I know there's time constraints sometimes, but I think just maybe as they start out, I think just not focusing on hitting every button, but just making sure you build that rapport and you really get to kind of the heart of why they're there.
Yeah, so we kind of talk about the idea of a narrative or a conversation when it comes to assessment, that you're really talking back and forth instead of, tell me about this, tell me about that, tell me about this. One area that I noticed is that, a lot of you who chose Maria and really Jacob, both of them are at risk for depression. And yet I only saw a few people that documented clearly that they had asked about things like specific types of abuse and suicidal or homicidal ideation. I mean, I would say if you have a client who's evincing any signs of depression, you absolutely need to be asking about suicidal thoughts, frequencies, and you need to document it. Even if she says, no, I don't have any suicidal thoughts, right? You have to document it, because God forbid, if your client does commit suicide, they could look back and say, you never asked about it, or you didn't note it. So I would say, how do you handle that conversation typically if you have a client and you're doing an assessment and they say, wow, I'm really struggling with a lot of depression?
Yeah. And obviously that can be a threatening question, I think, for a lot of people to answer, especially from someone they've just met for the first time.
Yes.
So I know, like at the psych hospital especially, I would try to kind of hit it in a roundabout way. I would say, one of the things we're learning more and more about in this field is the effect that major losses can have, that major childhood issues and major abuse issues can have on people. And you could even say, I've had other patients that have had childhood abuse, that have had even sexual abuse, that have had major losses. It's a little less threatening to say, I know other people that have dealt with that. Then you can bring it back to them and say, in your case, are there any things like that for you that you feel like you're still stuck on, that are still affecting you all these years later? And then it's a little bit more of a roundabout way, kind of validating that everybody goes through it. Everybody has trauma issues. And then saying, do you feel comfortable telling me some ones you're still dealing with? That's how I would approach it.
Okay. Yeah. And I know for me, depending on the assessment with the trauma stuff, I did a lot of normalizing as well, where I would say, hey, a lot of times in this field, childhood trauma is really widespread. A large percentage of Americans have experienced typically some sort of abuse. Normalizing. And then I would still be very clear about, I would say, have you ever been sexually abused by a friend or family member, or someone that you trusted, or a stranger? And then I might say, do you have any history of physical abuse, again, from a parent or a family member or someone that you knew and trusted? Do you have a history of neglect? And then as adults, I might say, a lot of times domestic violence is something that happens in relationships. Have you experienced domestic violence either as a teen or an adult?
Sometimes the best way to start an awkward conversation is to say, hey, I have a kind of a tough question for
you.
Or this might be kind of an awkward question, but I have to ask it. It gives people a little bit of an introduction.
Yeah, it prepares them for the fact that it's going to be awkward.
Yeah. And I don't remember what we were talking about, but there's some evidence that if you prepare with that statement, people then kind of gird themselves, if you will, for a tough question.
Yeah, but I think we do need to be clearly asking those questions.
That is true.
That sometimes it's easy to get vague and be like, hey, do you have a history of trauma? But for some of our clients, like what characterizes trauma? And also, too, we tend to think of those ones, the different types of abuse, but trauma can come from other things, right? Like, have you had clients who've had serious car accidents?
Yeah.
Car accidents, natural disasters. Have you worked with refugees?
Absolutely. Refugee trauma, yeah. Families that had a major financial loss, including during the recession.
Oh, my goodness.
Long ago, and lost everything. COVID-related job losses, family losses. I mean, there's a lot of kind of hidden stuff that if you don't kind of ease your way into asking, they might not ever talk about. And I think it's similar to with when you're asking about substance abuse. You make a good point that if you just say, you got any drug or alcohol problems? And they say nope, then the tendency is easy to just to move on. But you really have to say, all right, I'm going to ask you about some specific ones because there's some ones people forget about. And so, and you can kind of go through that way. But yeah, you do have to sometimes, if people seem like they're kind of blowing off a question, or if they have drug and alcohol problems and
right.
they tell you no, you do have to get a little more info, I understand. But I do think building that rapport or getting that permission to ask the question is important too.
Yeah. And I've even had clients where they're not comfortable towards the beginning. And so it's like, you know what, let's talk about this later. Let's get through the other ones. And then at the end of the session, I'll say, hey, I know at the beginning you were a little uncomfortable. I do have to ask. And then I talk about it.
Yeah.
So
yeah, that's a great point. Save the hard ones for the end.
Yeah. So now what I wanted to do, the second was question. So my husband he was the director at a psych hospital, a director of social services, and he recently moved. Now he's auditing. So he gets to look at assessments all day, every day from organizations and companies that bill insurance. And so he goes and he supports those providers. Here's how to write better notes. Here's how to write a better assessment. What are some pitfalls or things that you've seen that you just go, oh no, when it comes to assessments that people need to address?
Pitfalls. Let me see. I think, obviously from a clinical standpoint, if people are making a diagnosis and then they don't have any good justification for that, they're saying that she has major depression, but they haven't listed how that's affected her life, functional deficits, any of the criteria for major depression. They haven't used any sort of standardized tool like a PHQ-9 or an MDQ. And then we're saying major depression, it's kind of off the cuff, right? So that can be a problem to then have a diagnosis you're billing off of, right?
Right.
Excuse me. Well, one of the other ones is that when folks will just not ask anything about preferred gender, about cultural factors, about religious factors.
I was going to say spirituality falls at the bottom.
Social factors. And I've had a few assessments where people have said, so-and-so is a lesbian Catholic, client, but then there's no assessment later on about her sexual history or experience, no history about her religion and how that is both a strength or possibly a roadblock for her. Mm-hmm. And so if you were, you should be assessing that anyways. But if somebody especially comes in and tells you I'm having issues with this and you don't assess it, we see that sometimes with assessments. So.
Yeah, I would have that where clients would say, yeah, I'm really struggling because maybe I'm doing something that my church is against, or I'm thinking of leaving my church, or I'm really struggling. And so you have to make sure you dove into that it wasn't just like religion and then you list the religion there and then move on. Like you do really want to touch base because that could be a huge factor for a lot of things. And on the diagnosis, one thing I was going to say is I think sometimes when we're newer at this, there's a tendency to have the everything in the kitchen sink diagnoses. Like you just throw all the diagnoses at a client. And I think that really speaks to the problems with pathologizing a lot of our clients. So we have been talking yesterday even about the idea of depression and anxiety and how sometimes people can have both, but sometimes they're just symptomatic of one disorder. And so we have to be careful about how much we label.
Well, that's one thing we talked about too, is for a lot of purposes, for billing purposes or diagnostic, you really only need one.
Yeah.
So you might as well just focus on the one, because I've had assessments I've audited where they have 3, 4, 5 diagnoses and they don't justify all of them. And then you wonder, why'd you list all those diagnoses if you're not going to then justify them clinically? And then it makes me question.
Right. Other decisions you're making.
Yeah, the validity. So just keep it simple, I think, on a lot of those.
Oh, yeah, for sure. And I do think sometimes you can have a mood disorder and a substance use, and that's important to have both. But sometimes I think...
disorders.
Yeah. People just throw a bunch at once and you're like, I don't know. And really, for Maria's case, she meets criteria for a major depressive episode, but not necessarily major depressive disorder. Right, because in the scenario, her mom has died, and she's really, really struggling.
Adjustment disorder.
Yeah, that could be adjustment disorder. And really, a lot of times we did do adjustment disorder for things like, parenting issues, marriage issues, kid issues, grief stuff. Adjustment disorder is a very valuable diagnosis because it gives you something. Just says, look, you're not adjusting well to what's going on. And that's...
Which is very human.
Yeah.
That's why I always tell people, you're just diagnosed with having a difficult time in life right now.
Being human, yes.
Just fine.
How do you get between each section while using a reflective statement instead of saying, okay, and going to the next one, and it sounds good, and then going to the next section?
Yeah. And there's a balance there too, right? Like we joked about, you don't want to get stuck having a conversation, where you're 10 minutes in talking about education because you think their school is cool or whatever. There's a balance there, right?
Sure.
But I do think the unconditional positive regard we talk about, or the genuine interest in people's stories, that's what I tried to take into assessments, where I'd ask about something, and even if it was just a minor thing, they were a fan of a certain football team, and I'd say, "Oh, that's cool. Yeah, they got great players on that team. I really like that team too." And then you can kind of transition to your next question. But you've kind of validated what they've shared with you. You're
Right.
kind of thanking them in a way for sharing that, saying, "Oh, that's neat. Thank you for sharing that." Or,
Yeah.
That's good to know about you.
Exactly. So are we going to role play here? I'll scoot my chair back a bit. Okay. Okay, so we'll make sure we talk loud that you can hear it. So let's say I'm going to ask some questions about the medical section.
Okay.
Okay.
Are you the counselor?
I'll be the counselor.
Oh, okay. All right.
Okay. So we'll have Jacob is one of our clients, and he's an older gentleman who's had an increase in drinking when his wife went into the hospital.
Okay.
Now I have to get my role play move. Okay, Jacob. So one of the sections we always like to ask about is like medical issues, just because, there can be a relationship between medical stuff and maybe some emotional things or some of the things you're dealing with. So do you currently have any diagnoses or physical issues?
So I'm not sure what Jacob's actual scenario is, but I'll say for my Jacob, the doctor says my blood pressure is getting kind of high. He doesn't love that I drink as much as I do because it's, it put on the extra weight and, just raises a lot of issues. Blood pressure primarily is what he's concerned about. But, I don't sleep as well as I used to, but, it is what it is.
So it sounds like you've talked to your doctor about it. Do you take any medication for the high blood pressure?
Yeah. I take a blood pressure medication, and I take a statin for my cholesterol. And, my wife wanted me to do it, so I agreed to do it.
That can be a good motivator sometime to do things. And you mentioned you talk with your doctor. Do you do like annual exams every year?
Yep. Yeah. Again, I didn't used to. I used to think, I'll just go in when I'm sick. But again, my wife, really wanted me to do it. So I want to keep her happy. Happy wife, happy life.
Great. So it sounds like you've got some health issues. They fluctuated a little bit, affected maybe a little bit by your drinking here and there as well. But you're also talking to your doctor, which is great. And you've at least kind of run it by medically and you've got some medication for it. So thank you for sharing. So the next section I'd love to ask a couple of questions about. So that's our thing. So as we were going, I was engaging, I was asking questions, I was doing some reflection, even though it's medical, which is not really a section people are super eager to talk about necessarily.
And even if it was something I was sharing, or I was real stubborn about it, or sharing something really kind of awkward that maybe is like a men's issue, she still could validate that. She still could say, "Wow, it sounds like that's pretty tough. I haven't dealt with that. What's that been like for you?" And I think kind of having the open-ended, again, the inquisitive mindset and being open-ended with your follow-ups is a great practice for young social workers. So
I agree. So now you get to go role play. What domain do you want to ask me about?
Oh gosh, now that I'm talking the big game here, what am I going to interview you? Let's talk about like social connections, like social community, whatever you call it in your assessment. So
okay.
Hi Maria. We already met. Okay, we're in this section. Maria, the next thing I wanted to ask you about, I think it's really important when people are involved and have supports from something in the community, right? I mean, every client I've worked with over the years that's doing really well has something that they do that is supportive of them, whether it's school involvement, church involvement, sports, church. Does any of that ring a bell for you? What do you do in the community?
Well, I moved here from South America a few years ago. And so because my English wasn't great, it was kind of hard for me to meet people. Mm-hmm. And really my main social connection was my mom, and she passed away a month ago. And I feel like I don't really have anyone to talk to. My husband, he's a truck driver. He's gone for weeks at a time. And so I don't even know where to start when it comes to social connections right now, because this has been such a big change for me.
It sounds it's really overwhelming. That's what it sounds like.
It's so overwhelming because I don't know who to talk to.
Especially because you've lost your mom that was your main social connection. Wow, that's really hard.
Yeah.
Can I ask, in the past when you felt really connected, when you've had really good social support, how has that been different than it is now? Besides with your mom, obviously. How else did you feel more connected?
Well, I think there was a time where my little ones were really little and they were at school, and I was kind of like, I knew the other moms a little bit. Like, we weren't friends necessarily, but I had people to like wave to in the morning. And so I kind of felt like that was good. But, my mom had cancer, and so the last year I've just been really isolated, and I haven't really talked to any of those moms.
Yeah, wow. Yeah, and I think that's probably pretty normal, right? When you're focusing on something that's literally life or death. the rest of the stuff kind of loses its importance, right?
Yeah, like waving hi in the pickup line
Right.
suddenly didn't seem like a big deal.
Right. But it sounds like it was a big deal at the time, right? This was some way that you got some validation from other parents. You're kind of all doing the same thing, dropping the kids off, and you're kind of like saying, hey, I get you. I understand, the hustle and bustle. So was there ever something that you did that was, that would you consider more substantive, that you did a mom's group or a play group? Were you ever involved in something through the school, activity nights or things?
So that's it. That's our role play. You can tell we didn't practice ahead of time, so that was good. I hope this gives you a little bit of information of how to get from that initial open-ended question to then kind of go to those deeper levels, to have that back and forth with the client instead of a more traditional, hey, what about this? Okay, I take some notes and we go to the next section. So that is totally a skill, right? The skill of assessment it's something that a lot of us struggle with, and it takes a long time to build.
And Hilary asked me yesterday if there's one skill or one additional class to take when you're a young social worker. Take a motivational interviewing class. That's the most useful skill with difficult, stubborn clients, is to say, finding exceptions.
Yeah.
So it's not working for you now. Can you remember a time when it did?
Yeah, which was a great use of that.
Everybody can.
Yeah, that's awesome. Okay, everyone, I hope this was helpful. Reach out if you have any questions. Thanks.